Welcome back to the Grow Your Nutrition Business podcast, powered by Healthy Steps Nutrition Mentoring. At HSN, our mission is to empower people to take control of their health one step at a time so they can prevent and reverse chronic disease. I know that our small HQ location will not be able to have the impact that we could have if we don't have gym owners and coaches around the world with their boots on the ground using the Healthy Steps Nutrition Framework to help empower health in their communities. Today, I am so excited to have one amazing gym owner out of Idaho, CrossFit Amrock, share her story about how she is reaching out in the community to empower health. She has some really cool partnerships. They're doing some amazing things, and we are going to take a deep dive into that today. But first, let me introduce myself. My name is Nicole Aucoin. I am the founder of Healthy Steps Nutrition, one of the dietitians here. We are the home of CrossFit HSN and HSN Mentoring, a turnkey solution to help gym owners and coaches build, launch, and grow nutrition coaching programs. I am so excited about this week's episode, but we will get to that right after this message. Did you know that the Gym Accelerator Summit is coming up? It is April 18th to the 20th. It is a live event for gym owners and coaches who are looking to really empower health inside of their gyms. We have gym owners and coaches from the HSN mentoring family and gym owners and coaches that are realizing, hey, nutrition is the missing piece of the puzzle, and I want to get connected with people who are doing some amazing things empowering health inside of their gyms. It is an amazing 2.5-day event where you will learn, connect, have so much fun. I want to give you a personal invite to join us in Nashville, Tennessee. We only have a few tickets left. I would love for you to join us. You can click the link in the show notes to lock in your spot today. You do not have to be an HSN mentoring client to join us at the Gym Accelerator Summit in Nashville, Tennessee. All right, let's get to this episode with Andrea from CrossFit Amrock. Make sure you stay tuned until the end, where I take a little bit of a deeper dive into partnerships and what you can think about when creating partnerships and thinking outside of your box so that you can truly make a huge impact in your community. All right, let's dive into this episode. Andrea, welcome to the Grow Your Nutrition Business podcast. I am so excited for you to be on today to share all the amazing things that are going on at CrossFit Amrock.
Well, I'm really happy to be here and really excited to share as well.
Oh my gosh. So I want to backtrack to why this conversation is even happening. You come on our Owners Mastermind project every single month, and you always have great insights and share some different things that you guys are testing out and trying out and that are working. And I know it inspires other people in the HSN family to think outside of the box with how can we empower health not only for our members, but also have a bigger part in our community. And you guys are doing so many amazing things in your community. I have a giant list of stuff that I want to talk about today on the podcast. Let's just start off with a big picture. Like, what is your mission at CrossFit Amrock?
When we first started, our mission was, hey, we just want to help people because we enjoyed CrossFit. And then that's kind of evolved. We'll be in our 8th year of affiliation this summer. But it kind of became more of a passion of how do we change the trajectory of health for everybody, and really trying to outreach in our community. And every community is going to be a little bit different. So if we look in our area, like what's a number one thing that's driving it's, just unfit people, and how do we change that and create a space of community and wellness for our environment and our I guess, East Idaho area.
Clearly it's working because
Yes.
your gym has won the award for Idaho's best gym, best CrossFit facility in 2022, 2023, and you're up for it again in 2024. Yeah. So you guys are not only making an impact in your area, but Idaho's recognizing there's something amazing going on in this community and we want to highlight you. So super excited to dig in a little bit deeper. So, you guys offer nutrition. You've partnered with HSN for a while. You do nutrition within your membership, but then you also have gone out into the community. And let's start with employee wellness, right?
Okay.
Let's just start there. Talk to me about why employee wellness and what you guys have done in regards to employee wellness at the gym.
Yeah. So part of our goal last year was we wanted to try to expand our nutrition coaching, because not everyone has to be a member of the gym to benefit from what we offer. And so I kind of started with, okay, who inside of our gym or inside CrossFit Amrock has a business and runs a business. And that kind of became my starting lead list of who could I talk to about employee wellness. So I talked to one person. I took her to coffee and she said, I love it. And said, let's start I believe we started in September of last year. And she had 30 employees that live here. And then she has a bunch of remote. So the phase 2 that we're looking at is how do we do another employee wellness program for all of her remote employees, which is a much larger group. But we had 10 out of the 30 sign up for it. And they just loved it. They loved the engagement. We went to them. It was convenient. And it really got us thinking outside of the box of how could we do more of this in our area and approaching other businesses and outreaches, which led to us actually talking to a local hospital.
Which we are going to dive into the hospital. I want to talk about this employee wellness program. I think a lot of gym owners think, all right, employee wellness, I need to get people into the fitness. And that's not necessarily the case. I would actually venture to say the easier way to start is just going to them, doing nutrition, getting them walking, moving, bringing the community together, the employees together. Is it going to be an easier first step for them? And then inviting them to the gym, which is actually what you did. And you have members now at the gym because you started with nutrition, invited them to experience the gym, and then they stuck with it.
Yes. So we, with this employee wellness, we kind of, again, started to think a little outside the box. But if you look around, I mean, people that are sedentary and sit in their office all day, they don't move at all. And what was really transformational for a lot of this group was how active they were. And then even at work, the accountability they had because they would see each other. And, there's the Halloween candy that was sitting out and they would bypass the Halloween candy because they knew someone else was watching, and they just made different choices and made better choices. But then it was more of, they also had some accountability towards fitness, which just naturally occurred. And then my husband and I decided, well, why don't we just invite him for a workout on a Saturday? We'll coach it. And we had 6 come the first time. And then we did another one. We did 2 classes and I think we had 5. And then we had one of the members of the challenge bring her husband. And they just loved it. And from that, we gained 4 new members, and which was great. And they stuck with nutrition coaching for a few more months as well as fitness. So it was a win-win to see like their progress and transformation.
I think the coolest part of employee wellness is those people probably would have never stepped foot inside of your gym. And
Oh, absolutely.
It was through a connection, going into them, making it easy and convenient, building a relationship, earning their trust. And then I'm like, okay, yeah, Andrea's not that scary. I'll go ahead and I'll try her gym.
Well, and it was interesting too, because their boss, who was the one that said, yeah, she was one of our clients. They look at her as this person on this pedestal of, she flips tires and lifts heavy stuff. Well, first of all, she doesn't. She is an icon in our gym because she is 62 years old and is just a great athlete. But they think, oh, she flips all these crazy tires. And then when they came in and did their workout, they're like, that's not at all what happens here. So yeah,
I can do it, which is amazing. Yeah. All right. So one thing that I think is really cool that you guys do a really good job with that I think a lot of gyms can learn from is you guys intentionally capture stories of people that are doing awesome with your nutrition program, with their fitness program. How often do you do that? How do you ensure it gets done? And why do you guys invest money into it? Because you do bring someone in to help you do that.
We played a little bit of like the best way to approach it, and we found that quarterly is the best. We were doing monthly and it just got very tedious. So quarterly actually works really well. And then we identify at least 2 to 3 clients or members that we feel would be good testimonies. And usually one is nutrition focused, and the other two, it just kind of depends on what we want to target and what's happening. But whatever their testimony is, and those are all available on our social platforms and YouTube if you want to check them out. But we hire a local company, and they're actually wonderful to work with. And they actually help us with all of our social media and publishing, which has been super helpful. Yes, it's an investment, but it's more time than I can spend on some of these other things that generate the revenue, like trying to find more employee wellness potential clients or nutrition clients or other outreaches in the community. And that's where I want to have my focus. And so it allows me to be focused on that versus focused on these other little things. And the videos, what's great about them is I have someone else, they come in, they record it, and we're done in 2 hours. But the other thing that we've tacked on to that is we actually do a couple coach tip videos. So we have our coaches also do a couple tip videos that we put out there as well. So we get testimonials and tip videos. So we get 5 to 6 videos that we can use in that quarter. And it's been very beneficial.
We have so many success stories in our gyms, and I would venture to say that most people don't do a good enough job capturing those stories to hopefully inspire someone to take that first scary step to come into your facility. And, I think testimonials for employee wellness, if you're looking to expand in partnerships, this is so important. One of the cool things that you did is you actually built out a presentation from that employee wellness program that you were talking about earlier, and you used it to pitch a hospital to be the referral system for their broken system of helping people take control of their health. And you mentioned before we started recording that you actually sent a podcast that I did on our sister podcast, Nutrition Made Simple with Dr. Tom McCoy, who's an ER physician and turned into really having a private practice connected to a CrossFit affiliate. But he talked about how broken the healthcare system was and how just in the conventional system, it's not working. And healthcare partnerships, in my mind, are one of the best referral sources. The average doctor has like 1,500 patients. That's a huge amount of people that are coming through that need help. If you just look at the general statistics, 60% of people have at least one chronic disease that would benefit from nutrition, fitness, and accountability. And likely maybe just starting with nutrition and accountability and then adding the fitness side. So talk to me about the hospital partnership that you guys have set up. I think this is so cool, and so many gyms could do the same thing. They just probably don't know where to start. So talk to me about this hospital partnership.
Absolutely. Again, it's a member in our gym is where it started. She's been a member with us for over 5 years. Loves CrossFit and understands how CrossFit can be beneficial to the healthcare system. And so really trying to find someone that you can connect with and building relationship, because it's been a 5-year building relationship journey. And when we did this employee wellness program, I talked to her a little bit about it. She's like, well, I'm really intrigued by this. And so I sent her some information. And then we continued some additional conversation. I got my husband involved. And then we actually went to their facility and did a presentation to about 30 care coordinators. And the care coordinators are essentially the gateway to the doctor. So they're the ones that are seeing and caring for the patients as they come in. So some of them are nurses, but some of them are just that conduit between the patient and the doctor. And so that's the first thing. I mean, there's a lot of steps here, but it's a way we got our foot in the door. And with this, we created a referral system in that we created some postcards that the physician has that we've provided to each physician, and then a postcard that the physician can, or the care coordinator can give to the patient that says, okay, I'm overweight, or I have this chronic condition. I don't know what to do about it. And they're going to say, well, you need to start exercising, or you need some help with your diet, or you need help with accountability, whatever those things are. Hey, we have a really great place that we know that can help you with that. And they could give them that postcard. On the back end, the hospital would then send to us a referral form. And so the whole back end system, with HIPAA and everything, there were some things there that we had to set up that are private, so that we can have the communication with the care coordinators. So myself and my husband understand the chronic condition. But of course, that has to stay with us. So there's some sensitivity there to manage HIPAA. But we have the system in place. Now it's just finding that first patient and helping that first patient. And that's the process that we're in right now, is meeting with the hospital on a regular basis. Because this isn't a, hey, 1 month and I don't have anyone. It's been a couple months, but we've been persistent in the effort of just following up with them. We've now set up some things with insurance to accept insurance, which we can talk about. But it's just an ongoing process. So it's just being persistent and patient, which is sometimes hard when you're trying to build something. But we have a really strong feeling that this is going to be a gateway into something bigger.
I love that. And you guys started with a small group of care coordinators. You're working towards getting the information out to the larger group. And instead of it being
Right.
a telephone game, you go to them, do a lunch and learn, talk to them about, some tips that will probably help them, but then they'll build that relationship with you guys and want to send more people to you. You guys also talked about inviting those care coordinators to the gym to experience it as well, which is always a great way. Like, we're not scary. Come try it
Yeah,
out and just
exactly.
experience it together and have a good sweat together. And then you guys can do a cool down and talk about the nutrition and fitness programs that you offer.
Well, and it's also that community. I mean, we all know that. I will tell you, the one thing I love about CrossFit is community, and you can't find it anywhere else. The community and accountability is by far the best and ever. And what's been interesting in some of the in the employee wellness program, when we did bring that group in, even how more connected they were, because they were this little community. And it's been fun. Just maybe a little tangent here, but two of the people, it's a husband and wife that, so the wife did the employee wellness challenge, and the husband came along to work out. Now he became a client, and we just did a performance nutrition challenge internally, and he did that because he saw the progress his wife did.
Yeah.
But they want to be healthy seniors. They have grandkids. They want to play with their grandkids, and they just want to be, the cool grandparents. And we talked to them about the open.
Yeah.
We're like, what's this open? We're not sure what is this? And we do intramurals and we make it very fun. And they came their first week, and they came up to me and they're like, Andrea, I'm so glad we did this. This is the best thing ever. This is so much fun. The way the community comes together. And so they're even more invested.
Yeah.
But it all started with his wife starting and making it, and it just became a domino effect.
Yeah.
And so there's a way that we can impact people. It's just how do we move that needle with every person? And it's patience and perseverance in working on those people. And I think with the care coordinators, it's going to be that same thing. Hey, bring them in. We're going to do a couple workouts with this small group. And then the intent is now we're going to get the larger group of care coordinators to come in, and we do a few sessions so they get to know a little bit about us, and that CrossFit isn't scary. It really can be modified and scaled to meet every person where they're at, no matter where their fitness level is. And it's really just overcoming that obstacle.
I love that. I love that. It's amazing. I'm excited to watch what you guys do and the impact you make in this hospital setting, because those are the people that need it the most. You mentioned that you guys are taking insurance. TrueMed is something that is building traction around the small boutique fitness space. There's money in HSA and FSA accounts that most people are not using. that they have available that can pay for nutrition coaching as well as fitness. Talk to me about how you guys are partnering with insurance companies. You also have the American Specialty Health
Mhm.
program that allows
Yep.
you guys to get reimbursement. Talk to me about those two programs. Let's start with TrueMed first.
Okay. Yeah, when TrueMed came out, we jumped on that right away. I have a couple years background in benefits myself, so understanding the significance of a health savings account or a flex savings account, um, and how it can help you in the industry and paying for things. And when that came out for CrossFit, I was like, oh, we got to jump on this right now. And so we immediately got on it, rolled it out to our current members. I think we have about 10% of our membership that I know of that take advantage of it. It was super easy. Takes less than 10 minutes to set up everything. But it's a great retention tool for us, because let's say someone is, hey, I just have some budget issues or financial things going on. Hey, let me ask you something. Do you by chance have an HSA or FSA? And they'll sometimes look at me like, what is that? And so I explain it to them. And they're like, oh, yeah, I do. And I said, well, do you know you can use that to pay for fitness or even to pay for nutrition? So you might have someone that's doing fitness with us, has been doing nutrition coaching, but some things are tight for them. And I actually have saved a few people and maintained them on nutrition coaching or fitness because of that HSA and FSA. So it's been a really great retention tool for us.
I love that. That's amazing. And if people aren't using it and it's
Mhm.
going to waste, like, okay, let's use it and let's
Yeah,
allow them to potentially even add nutrition coaching. I had a
correct.
member last week say,
Mhm.
"Hey, I have an HSA account and I want to get back on nutrition." Okay, awesome.
Yeah,
Like, let's do
awesome.
it. Super easy to be able to get set up. If you are a gym owner and you want more information about this, I will put the link in the show notes
Mhm.
so that you can get an account set up again. Really easy. It's a one-time fee that you can pass on to your members, and then they just get reimbursed through their insurance company. Very, very
And
easy.
I haven't heard of anyone getting denied.
Yeah.
It's the approval rate for someone. I think it was 97%, and I mean that's very, very high. And I think one piece that people don't realize is if you have an FSA, if you don't use that, you will lose it. So at the end of the year, only I think it's $610 can roll over into the next year. So let's say you've opted to have $2,000 in your FSA. And let's say you have $1,500 and it's October, you're going to lose that if you don't use it. And so what a great way to use your money and and save some money, because this is all pre-tax dollars. It's such a huge win-win for everybody.
Yeah. I love that. Talk to me about the American Specialty Health that
Mhm.
you guys are involved with too.
Yeah, this again took some time to iron out everything. Because at first, Um, the reimbursement wasn't great, but I know that CrossFit has gone in and done some negotiating. And so what's great about it is, and there's a little bit of work to this, and we're still working through that process, but it just opens the door to more people getting a little bit more of a discount on their membership. And essentially, how it works is that the member or the potential lead might be interested in a membership, but maybe there's a financial boundary for them. We can always ask, hey, who's your insurance? And certain insurance companies are in this platform. And with that, then they can essentially go in and set up an account for free with their insurance provider. And it's through Active and Fit is where American Specialty Health partners with Active and Fit, which is also Silver and Fit. So there's two different branches there. Um, but instead of paying, I think they save almost 30% off of membership from us. And right now, we're the only CrossFit box in our area that offers it. And if you have, and they do take a lot of different insurance companies. Again, it's just reducing that barrier of cost or financial means of giving them a fitness routine and community and accountability that is valuable. And it just reduces that barrier of, oh, well, I pay my insurance company for my membership. They're not paying us. We get the funds back from the insurance company. And it's simply us sending them an attendance report saying, hey, Nicole attended 8 classes this month, and we get the full reimbursement. So as long as they attend 1 class a month, you get the reimbursement.
Wow, that's awesome. You guys are doing some really cool things to bridge the gap between fitness and healthcare and really become this house of wellness. You guys have partnered with HSN to deliver nutrition
Mhm.
coaching. Why did you guys partner with HSN to do the nutrition coaching component?
Yeah, really great question. So when we started CrossFit, I mean, this wasn't anything my husband and I had on our plan. This wasn't, it kind of just evolved for us. And, we started and it was hard, being a business owner and not knowing much of what to do and figuring things out. And after a few years, we noticed a gap, and the gap was nutrition. And I have a passion for nutrition myself. I have my own health journey and background of autoimmune problems and being very self-conscious of food and what goes into your body and out. And I needed to find a place that could help us with nutrition, that I wasn't having to figure out the whole platform myself. And that was what was very difficult and a lot of research that I was doing. And I had someone recommend your book. And so I picked up your book, and I was traveling internationally and read the whole book. And I looked at my husband and said, we need to do this. And I set my call up. And I mean, that's kind of the start of the story. And it's made a huge impact and transformation for our people and myself and my husband. And we're just really excited to have that gap filled, and being able to provide a service. Because if you think about, I mean, we all know the CrossFit pyramid, and the base of that's nutrition. And you can't out exercise a bad diet. You can't, and there's just something about nutrition that is critical and key. And a lot of people forget about it.
100%. I think, thank you, first of all, for trusting us to help you. I'm glad you got the book and you read it quickly. The writing's a little bit big on that book, so maybe that's how you got through it in a weekend. That's amazing. Um, the truth is a lot of gym owners think, okay, if I add nutrition, I'll be able to help my members. But I think this whole podcast you shared how the addition of nutrition, yes, it's helped your members, but it's really opened the door to be able to
Mhm.
serve and impact more people in your community that would have never found you in the first place through employee wellness. And now they've become fitness members too.
Mhm.
And now setting up different partnerships. And yes, we talked a lot about employee wellness and healthcare partnerships, but you guys also do some really cool things with other
Mm.
local community partners as
Yes.
like member benefits and member perks. Talk to me about
Yes.
how you guys do that as well.
Yeah. So again, it's who do you know? And literally what I tell people is write down a list. What friend do you know works at what business, and or what prior bosses or prior people that in your inner circle, whatever that is, like write down a list, because that's what we did. Wrote down a list, and that's how we started off with some of the partnerships. And then in addition, think about people from high school that you might see here and there, but maybe they've opened a business and there's a way to make that reconnection. And that's essentially what we've done is over time between our members inside, and we might say, hey, we're looking for this. And we've just outreach to our members, and they're like, oh, I know so-and-so that does XYZ. Great. Can we talk to them? And through that, we've kind of built, it's small right now, but we have more that will be expanding, and we have expanded throughout the year. of different restaurants, other partnerships from, I'm trying to think on the back of our card, but there's like a kids outdoor grit league is the name of the company. And they do outdoor Spartan training for kids. And so there's other partnerships and other ways that you can kind of create. And then what we did is we made a card for our members. So they kind of felt a little special, I guess, like special, like, hey, I got a little perk card that I can use at these businesses. And then we found some healthy restaurants that kind of align with what we teach as far as vegetables first and protein. And we've got a couple of restaurants that do support that as well. And then throughout that, we found a fitness company that in town that will give our members 10% off of their purchase, but then we get a 3% back. So then we can actually put that towards prizes or future gym equipment. So if they go in and purchase something, then they just keep a tab for us. So it's a win-win on that end as well. So it's really about who do you know and who can you talk to about, hey, and even if it's 10%, we have some that are 20%. We have some that are buy one, get one. And then we've just used those. We recently just did one with a relaxation center. So stress is one of our things in HSN. And this place offers red light therapy, green light therapy, and a lot of other therapies to kind of help people relax and reset the mind. And we essentially negotiated a 50% off of monthly membership for our members.
That's amazing. You have the power of all of these people that
Correct.
you can use to negotiate instead of them trying to do it one off. And then that's a huge perk to be a member at your facility. You get all of these
Correct.
extra perks and discounts because you're investing in this membership. You get all these other cool things. So
yeah,
I love that. Andrea, you guys are doing absolutely amazing things. Thank you so much for coming on the podcast, sharing your story. We're going to have all the links that we talked about, and I'll even put the presentation, you gave us access to it, that you shared with the healthcare professionals. So if people are like, man, this is so cool, I want to do something similar, I want to get some ideas, some inspiration, they can check out. If you click the link in the show notes, we'll have some different examples from you on there. So thank you so much for trusting us to help you with the nutrition component. You guys are doing absolutely incredible things, and I'm just excited to be a small part of all the impact you're having in Idaho.
Well, we appreciate you guys. Thank you so much for all the support.
I hope you enjoyed that episode with Andrea from CrossFit Amrock. She's doing some incredible things, and I wanted to talk about a couple of things that really stood out to me. Number one is when she started working with employee wellness and expanding her reach outside of her gym, she started with the people that already knew, loved, and trusted her first. So start with those people that are your members that you already have connections with. The other thing she mentioned multiple times was really cultivating that relationship. It's not a light switch. You have to nurture the relationship. You have to stay front and center of their mind. Healthcare professionals are so busy. Businesses are so busy. So if you leave all the follow-up on them, the likelihood of you really building something and making the impact that you could is probably not going to happen. So leave the follow-up on you, nurture those relationships. When it comes to partnerships, there are different types of partnerships that you can establish. And I think it comes down to the goal that you're wanting. Are you looking to get exposure or give that company exposure to your audience? Are you looking for referrals? Are you looking for some type of financial incentive, either a discount that you can pass on to your members or a kickback? Andrea mentioned that she has a couple of those partnerships set up with different businesses locally. But looking at what can you do? How can you help first? How is this going to help your current membership? Or how can you support the audience of this other business? How can you help them? So look at the different types of partnerships, lots of different opportunities here. I love to combine these things, like getting exposure. Consistency is a big thing here. When you think about exposure, people need to see things 7 to 10 times before they take action. So if you just do a partnership where there's one social media post or one email blast, the likelihood of you really seeing the fruit of your labor there is not going to be as much as if you are consistent. Can you give them a healthy recipe to send out every single month? Can you offer a a takeover for the company to do a couple classes once a month? What can you do to help them build that trust with that following? Lots of different options there. We're going to be taking a deep dive into partnerships and employee wellness at the Gym Accelerator Summit. And if you are an HSN mentoring client, on March 21st, we are hosting our monthly training webinar just for you guys on the roadmap to establishing healthcare partnerships. So I'm going to take a deep dive into how we've done it at Healthy Steps Nutrition HQ. We have different partnerships with primary care physicians, pediatricians, pediatric GIs, physical therapists. We have some really cool things that we're doing with just nutrition coaching with a couple physical therapists that I'm excited to share with you guys. There's also Canva templates for brochures and everything that you need to set this up in your own community. So if you're an HSN mentoring client, join me on March 21st, or of course, if you can't make it live, then you can catch the recording. There's a huge opportunity here for gyms. The average primary care practice has over 1,000 patients, the average, and some of them have over 2,500 patients. If we just do the stats, 60% of those people have at least one chronic disease. They need your help. Primary care physicians don't have the time and capacity to pour into their patients to give them what they need to make lifestyle and meaningful changes to prevent and reverse chronic disease. They're giving medications. They don't have enough time to really dive in, and they definitely don't have accountability and support systems built out like you can have. So amazing opportunities here with healthcare partnerships. I'm so excited to give gym owners and coaches in the HSN mentoring family the roadmap to all of this. And of course, you can catch the recording if you're part of the HSN fam after it is live. Well, hope you enjoyed this podcast episode. We will give a couple examples if you click the link in the show notes of what Andrea is doing, and make sure that you subscribe so you don't miss another episode. Hope to see you at the Gym Accelerator Summit in Nashville, Tennessee.